Hello everyone, I'm David and welcome back to another first aid skills video. Last week we went over or the last 2 weeks we went over a whole scenario of adult CPR. So this week's video is going to be quick because we're going over child and infant CPR, and they're quite similar. They just have a few subtle differences, though important. The majority of it is still the same. So we'll start with child. So when looking for child, that's anything from the age of 1 to the onset of puberty, whatever age that is for that specific person. Things to keep in mind for when dealing with a child. I'm just going to use the same mannequin for a child because some children can be close to the size of adults. Or just a little smaller, is the depth. So when we did adult CPR, it was 5 centimeters of depth for compressions. For child, it's 1/3 of the depth of the chest. So we don't want to push down quite as deep onto a child just because they're younger, more fragile, and we just don't have to squish the chest that much. We risk causing more damage than good at that point. So depending on the size of the child, we can do line up our nipple line, we can do our 2 hands, 1/3, or if they're smaller and we can get the depth and we want to be a little more gentle, we can opt out and just do 1 hand instead, because that kind of takes the power we have away of 2 hands so we don't accidentally push too deep. And so 1 hand makes it a little harder for you, the first aider, but it makes it easier on the body for the child. Same thing the breaths and compressions are the same, so it's still 30 compressions to 2 breaths. Another thing to keep in mind is when you're giving the breaths, you don't want to give quite as much as you did for an adult. Smaller person, smaller lung capacity, so we don't want to push as hard. So when for a child, same as an adult, 1 second breath for your 2 breaths, just enough to have the chest rise. So we're not trying to inflate them, we're just trying to get a little bit of rise and then in. Another thing to consider for child, if you're alone, when you're doing it on an adult, when you're alone, you find them. If you're alone, you go call 911, get your AED and your first aid kit and come back. And then you start doing your compressions and breaths. With a child, you do a full cycle first. So if you come up on the child, not breathing, unconscious, don't run off and call 911 and get an AED right away. Do your 2 minutes or your 5 cycles of CPR first to prime the body, and then call 911, get your AED, and come back. The reason for this is children's bodies, they don't compensate as well over time. So an adult body can take care of itself with the residual oxygen that it has in the body from when they stop breathing, whereas children decompensate quickly. So they'll be okay, and then when the oxygen in the body hits a certain level, they tank. So we want to get that oxygen and the blood pumping through their body first, and then we run off and do that. So that's for child. Now for infant and child are quite similar. So for depth as well, it's 1/3 the depth of the chest, but for infants, which we consider anything younger than 12 months, you want to use 2 fingers. If we line up with 2 hands on an infant, we're going to go way too deep, way too easy. And even depending on the size of the infant, 1 hand might even be a bit much. So we take our 2 fingers, preferably 2 fingers. You don't want to use your thumb, because your thumb, you can still put quite a bit of force in with your thumb. And your fingers, they'll get sore, but that's also restricting you from doing too much. So we find our nipple line still, 2 fingers in the middle, and we just go 1/3 the depth of the chest. The rate of CPR is the same for adults, children, infants. It's always 100 to 120 beats per minute. Children, infants, 1/3 the chest, adults, 5 centimeters. Infants as well, if we're using our pocket mask that we have when we're giving our breaths, we want to make sure that we don't, when we do our head tilt chin lift, we aren't cranking the head right back. What we do for infants is what we call the sniffing position. So if you're smelling something, that's how much you move your head when you smell, which is why we call it the sniffing position. So we only move it a little bit, like the baby sniffing. There, just enough. And then if you look, this fits me very well. Nose goes in the nose cup. But if you put that on an infant, it doesn't work as well. The nose cup might come out over the forehead, and here we have a broken seal. So the trick is if we take it and we turn it upside down, so now their chin goes in where the nose cup is, it better matches the shape of their face. So you get a much better seal with a flipped upside down mask like that, as opposed to right stuff like that. And breaths as well. Remember, it's just for chest rise. We're not trying to pump them full of air. So you get your mask, you put it on, you get your seal, you do your sniffing position, and you just do a little like that. So you can think of blowing out your cheeks. That's a breath. That's all you really need for giving a breath to an infant. So, same thing for if you're alone on an infant, make sure you do your 5 cycles or your 2 minutes first, and then run off and get your AED and your first aid kit and call 911. So that's it for this week's video. Nice and easy. That was covering differences between child, infant, and adult CPR. Next week, we're going to get into applying AEDs. So that's where we get into the machine that I showed you a couple weeks ago. How to apply that, how to use it, and how it kind of works in the scenario. So I might do a similar thing where we'll do a full scenario, the AED will show up, and I'll put it on and show you how that works. So that's it. Thanks for tuning in for this week, and I hope to see you all next week. Bye.